A 13-year-old female injured her right shoulder during a cheerleading event. Initially, her CRPS symptoms were controlled with physical therapy and sympathetic nerve blocks. Over time, the nerve blocks became less effective, leading to depression and spreading CRPS symptoms throughout her body. It became impossible for the child to attend school.
Today's July 12th, 2010, and Aaron, you're from Tarpon Springs, Florida.
Yep.
And let's give a little brief history before we do anything on you. 2006, approximately a little over 4 years ago, you had an injury to that right upper extremity, correct?
Yep.
Tell me briefly what happened.
It was a cheerleading accident, and I just hurt the top of my shoulder, and I never really let it heal or anything.
Yeah, right. And then what happened is about a year later, you started spreading and having similar symptoms down here into your left leg.
Yep.
And now it has diffuse allodynia throughout. Any type of tactile stimulation there is perceived as being painful. And you've also gotten, that's why we got these little beautiful marks on you here, isn't it? Because to the right side of your face there, where those marks are, is where you have the allodynia, and you got it going right on down here and curving over into this extremity, the whole extremity over here, except for, and we marked it here, turn your hand, atta girl. We have some marks here. You're not too bad down in here, but
No.
once we get up above that spot there,
Yeah.
you have that severe allodynia. It feels like road burn. Okay, so in trying to control this, you had about 14 right stellate ganglion blocks, and you had about 14 left lumbar sympathetic blocks. And what's happened over the years is that you're becoming less responsive to that. In fact, situation seems to some extent to be getting worse because you've had to drop out of school, which is not good. You're still in high school. That's not good because of the symptoms. Is that a pretty accurate picture of where you've been up to this point?
Yep.
Okay, good. Now, let's go through some basic exercises with you, okay? The first thing we want to do, and I would suggest you probably want to use your left hand for this because it's less painful. I want to see if you can take 2 vertical fingers in your mouth, and I'm going to come over to it from your side here. Are you having pain when you do that?
Yes.
And tell me where you have the pain when you do that. Point with your
In
hand.
my jaw.
In your jaw?
The
On
right
both
side of
sides?
my face,
Is
yeah.
it worse on one side than the other?
Yeah, the right side.
Right side's worse? Yeah. And I would imagine that makes eating not so enjoyable for
Right.
you. Yeah, right, exactly. Now, the next thing we want to do is we want to take that right hand and put it behind your head as if you're going to comb the back of your hair. Stop if it's too much for you. You got it back there?
Yeah.
Now, with your other hand, point to where you feel the pain. With your left hand, point to where you feel the pain in that right extremity. Go ahead and point.
All in my left arm and my hand and the back of my scalp.
And the back of your scalp. Point to your back of your scalp. I didn't quite get that. Right in there. Okay.
Yeah.
And again, more on your right side,
Yes.
correct? Okay, very good. Now do that behind the head with the left side, please. Atta girl. Good job. You having any pain when you do that?
Only in my scalp.
And your scalp, again, point to where that is.
Right here.
Right in there? Okay,
Yeah.
very good. All right. And you know the problem with all that is, don't you? If you go to any doctor that doesn't know much about RC, he's going to say what? You are crazy.
Yes.
Doesn't he? Yeah, that's the sad part of this whole thing. So we see this, what you're describing, where you get these pains being initiated, just far-reaching areas on your body is something we see quite commonly with this RSD. Now, next thing I want to do here is I want you to take that, we already documented that you have all up and down that right side allodynia throughout, except for perhaps maybe in the palm of your hand near your fingers there on the ventral side. I want you to take that right hand out in front of you and open and close it as fast as you can. Fast, fast, fast. That's it. Okay, over here on the other side. Get a little speedy, a little more speedy there, aren't you? Very good. Excellent. Good job. Good job. Now, as we know, on that left leg, you got allodynia all up and through that leg. There's hardly any place except maybe the tips of your toes where you don't have the allodynia.
Yeah.
However, on the right side, on the other hand, you can touch it, lightly stroke yourself there with your good hand. Yeah, you can handle that, right?
Yeah.
Doesn't feel like road burn.
No.
But just give us a really nice, just that feels like road burn, right?
Yeah.
And down below, please. Yeah, there you go. Okay, good job. Now, I want you to take that right ankle and do a rotation for me, please. Atta girl. Wiggle your toes for me. Atta girl. And hitchhike back to Tarpon Springs. Okay, excellent. Now, do the same thing with the other, please. Atta girl. Kind of sluggish there, aren't you?
Yeah.
Wiggle your toes for me. You good, good. Point on back to Tarpon Springs. Okay, good. Good job, Aaron. Now, once you get up, you go by the door there, please. And I'm going to ask you to walk toward me. And as you do that, go ahead and walk toward me. That a girl. That's it. And walk on back over, please. That a girl. Yeah, that's fine. That'll work. Now, let me ask you a question. Now, did you have pain when you did that?
Yeah.
And on that, specifically on that left leg of yours, point to where you felt the pain when you were just walking normally like that.
From my hip all the way down to my toes.
And was it just in a certain distribution, or just all the way around your leg, all the way around?
All the way around my leg.
All the way around, and
Yeah.
primarily on that left side, correct?
Yes.
Okay, very good. Good job. Now, Dad, I want you to stand up by her, please. Okay. And probably on her left side, please. That's it. That's her better side. And if you need, yeah, that's all right. That's okay. That's okay. Now, hold his hand, but don't use him unless you need him. Okay, Aaron?
Okay.
Only if you need him for balance, because I don't want you to hurt yourself. Now, I want you to come forward a little bit because you're not ready for you to do what I want you to do. So you get in, there. That's perfect right there. Now, what I want you to do now is I want to see if you can take 3 tippy toes toward me. Can you do that?
Yeah, that's right.
There you go. Good job, Aaron. Good job. Good job. Okay, kind of don't want to put much weight on there. Now go on and tippy toe back to where you were, please. And then I have a question for you. Okay, when you did that, was that pain any different than the distribution of the pain you had when you were walking normally? Is it different?
Yeah, it's worse.
It's just more intense, but the
Yeah.
same distribution of the area
Right.
that you described, correct?
Yes.
Good. Now, I want you to do the same thing on your heels, too. Again, your dad's there. Don't use them unless you need them, okay? That's a girl. Good job. Good job. Okay, and I go on back, please. Very good. Good job, Aaron. Now, tell us about that experience. What is that like compared to the toes? Is
It's worse than the toes.
okay, so it's more painful to be on your heels,
Yeah.
huh? Uh-huh. Okay. And if your dad wasn't there, what would you consider, especially on your heels? Would you be safe to walk on your heels?
Probably not.
Probably not. Yeah, you could fall and re-injure yourself, right?
Yeah.
And as we talk, re-injury and getting yourself into a stress ball with stress is 2 things we really have to try to avoid, right? Okay, why don't we switch sides? You can come. All right, so you knew what she was like before 2006, a little over 4 years ago. Why don't you tell us about the kind of activities Aaron was into?
Well, Erin was an all-star cheerleader for many, many years, traveling with her squad around the southeastern part of the United States to compete at a very high level. Always was a great performer. The girls won an awful lot of different championships, and she was very active in school, was a very good student, did a lot of outside activities besides the cheerleading. So, acted really as a normal little girl. So,
right. So why don't you tell me if you just if you feel comfortable to talk about how this has impacted her from an emotional standpoint.
Well, yeah, it's been devastating for her. I mean, like she stated before, that she's been through. She'd get through the first part of school, the first half of the year, and then the second half of the year, she'd be either in homebound or not attending school at all. I mean, obviously that has an impact on her self-esteem and really her interaction with her friends, even albeit that she's had great support from her friends. So,
right.
That's try to help her through this.
Right. Well, let's ask you, do you have any questions at all about the treatment?
No, not at all. I'm very confident. I know that you're confident about what's going to happen here, and you feel very good about the fact that she should react very well to this. So
yes.
I'm very confident myself. I'm excited about this opportunity.
Okay. Aaron, do you have any questions?
Nope. You've explained everything really good, and I'm excited.
Good. Look over here. Look at me. Over here. I'm over here. Can you open your eyes and look over here? Up here. Over here. Open your eyes. Okay, open your eye for a minute. Can you do that? Here, we want to show your dad something. You look at her eyes and watch it. See the jerking going on there?
Yeah.
That's what ketamine does. Yeah. Okay, your dad has some questions for you. See how well you can answer them, okay? Here it goes.
Erin, what's the name of your pet?
What?
What is the name of your pet?
Tarantula.
What's a tarantula? What is his name?
Timmy.
Timmy, you're right. What's the name of your sister, your little sister?
Emily.
Sure. How about your boyfriend? What's his name?
Will.
Yeah, there you go. Now, do you know your dad's name?
Ed.
There you go. Okay.
Hey, Aaron,
Yeah.
I want to ask you a more difficult question. You ready?
Yeah.
What city do you live in?
Tarpon Springs.
Tarpon Springs? What state is that in?
Florida.
Yes, you're pretty much with it. You know that? You're on 200 milligrams an hour. Do you know that? Yeah, your brain is fairly well intact. What's the matter? Don't you look over here? Can you look up at me here? Yeah, there you go. Over here. Look up. Look up over here. Look up higher, higher, higher. Come on, get it up there. Get those eyeballs up there. Can you get up there a little bit? Aaron, are you seeing double or single when you look at me? Are you seeing double or single? What are you doing?
Double.
You're seeing double? Huh? Or triple? What do you see?
Whoa.
You're seeing both? Huh? Okay, you're doing great. You're doing good. By the way, your vital signs are very stable over here, okay? 99% on your saturation, 132 over 80. You can't beat that, all right? You're doing good.
This has been very consistent last 45 minutes.
That's right. You only got about a half hour to go and you're done, okay? You're doing great. All right, show me the sign. Let me see if you can show me the sign. Show me the sign. Let's see the sign. All right, I see one. Where's the other? Come on, let me see the... No fingers. Don't... there. Yep, you did it. All right. All right, okay, we're going to turn the light. You want us to leave the light on or off?
Off.
Are you sure?
Yes.
Okay. Okay, Aaron, it's now July 16, 2010, and this is the day after your third and final ketamine infusion. We just went over your pain thresholds over here just a little while ago, and we found dramatic improvements in your pain thresholds. Also, when we look at the curves that were generated, it would suggest that you might even benefit from a fourth day, even more from a fourth day of a 4-hour ketamine infusion. Now, let's go and discuss how things went during the infusion itself. You were remarkably stable throughout the infusion, up to 200 milligrams an hour. In fact, I think you could probably go even higher than that if we wanted to, because you were so stable. However, we did learn something that is typical, very typical of patients. And you're 17 years old, so you're a young patient. And one of the things that was pretty apparent is how important it was to have a significant other by your bedside, which happens to be this young man over here, your father.
I appreciate that. Thank you.
And because when we got you up to up to 200 milligrams an hour, your father just had to leave the room for just a short break, and boy, you just went pretty nuts. And the point is, it points out that the familiarity of his voice, of him being there, if you're having an uncomfortable sensation, and you did, that it helps take the bite out of it, doesn't it?
Yeah.
So tell us about the uncomfortable sensation. Describe it as best you can. What was it?
Well, towards the end, when the doses started getting higher, it almost felt like you're fighting life and death. You're like right in the middle. And with my dad there, I felt more comfortable. I wasn't scared at all, but the second he got up to go to the bathroom, I freaked a little bit, and that's when it became scary.
Right.
At that point.
And if it was somebody that you really didn't know that was
Yeah.
there, if a doctor or a nurse, especially if it was a doctor, right?
Right.
It wouldn't be as comforting, would it?
No.
Not at all. So again, I think that's one of the take-home messages and a very educational point, and that's one of the reasons we're putting this, making a little educational video out of this today, is that. The other thing about your situation, which is nothing new, and that is you're not an easy IV stick. If we look at your arms and so forth, you really don't present us with a lot of access as far as veins are concerned. And so we talked about a Mediport option with you. And why don't you tell me why you're giving that some serious consideration right now?
Well, prior to the procedure, when you had to stick me with the IV, we had to do like 8 sticks because my veins are...
Was it 8?
Yeah, it was 8.
You're not exaggerating.
No.
Was it really 8?
Yeah, it was 8.
Oh my God, that's terrible.
We had to try to go in my foot and
Yeah.
my bad arm and stuff. And
So-
it's always like that when I get blood drawn or if I've ever had to have any other IVs.
Right.
It's virtually impossible.
Right. And why is that? Why would you consider that dangerous?
Well, I know that it's easy for the RSD to spread because in me it has spread from my arm to my leg, and with re-injury and just simply sticking the IVs, that can cause it to flare up.
And where do they usually put them? They usually put them in your upper extremity.
Yeah.
If you got a bad one already, and then they put another one over here, there's nothing more disabling than to have 2 extremities that aren't working. Right. So, so I agree with you. I think that's something that really needs to be given serious consideration, even at your young age. Okay. And it can be removed. It's not a permanent thing.
Right.
Okay. All right. Now let's go on with assessing your function at this point. Okay. Oh, wait a minute, before I forget, I think there were a couple other points that I wanted to make about how things went during the infusion. In the beginning, you had some issues with nausea and vomiting.
Right.
And we fixed that, didn't we? Mm-hmm. How'd we fix it?
Well, you prescribed me Zofran.
Yep,
Is that right?
that's right.
And I took
16 milligrams.
And I took 2 of the pills an hour before
Right.
the infusion.
Right.
And then waking up from the infusion, you gave me, I think, 2 milligrams of Versed.
Right. Letting you wake up slowly
Right.
helps keep the stomach calm. Okay.
And I did fine after that.
Yeah, you did fine. In fact, all you could talk about after that last infusion was how hungry you were.
Yeah, I was starving.
That's right. Okay, you ready to go on with the functional testing here?
Yep.
Okay, here we go. So I want you to take your, which was your worst side, is take that right hand and put it behind your head. And if you're having pain, I want you to point to where it is.
Just in my shoulder
Right.
a little bit.
And before, as you know, it was the entire extremity extending into your neck area, wasn't it?
And in my scalp.
And into your scalp, right?
Yeah.
Now put the other, make sure we haven't caused any new problems. You're no problems with that one,
Nope,
right?
none.
Okay. Next thing we want to do here with you, Erin, is remember the vertical finger test? Look straight ahead. Don't look at me. Put those 2 vertical fingers in. Can you get them in there? Okay, good. Now take them out so you can talk. Did you have any pain when you put your fingers? No.
None.
So that's all gone.
Yep.
Yeah. And remember, it was worse on your right side than on
Yeah.
your left side. You remember that?
Yeah.
Okay. You remember how before we did the infusion, you had this real sensitive skin on the right side of your face? I put a couple marks there just to remind everybody where we started. So go at the top of your forehead on the good side and stroke across and see if you're having as much pain there or any pain at all.
None.
None. And tell us why that's important, that pain is gone.
Well, everyday tasks like washing my face, brushing my teeth, eating, putting on makeup, brushing my hair, those were all really painful and hard. And now
Right. And you remember how the top of your head was really sore? Remember that? Go up there now with your hand. Do you still have that pain up there?
Nope, none.
None. Okay, good. Now, the next thing we want to do here is we want you to take, remember, turn your right hand over. Remember, you were okay down in through here, okay? But then you were very sensitive about that. See if you can strike yourself up lightly and tell us where the allodynia starts when you go up now.
Right around here.
Right,
around
so
the
it's
dots.
shrunk up, huh?
Yeah.
And is it as intense as it was before?
No.
Okay. Now, the other thing I want you to do is go ahead and take your right hand, your bad hand out in front of you, and open and close fast you can. Fast, fast, fast. Yeah, it looks a little faster to me. Okay, do
Yeah.
the other one for comparison. Yep. You feel like you got better control of your hand?
Yeah.
Okay. All right, now we're going to turn down to the lower part of your body and focus on, remember your right leg, left leg was your worst side. Remember how you had the allodynia. First strike your thigh on the right side, please. Yeah, that was okay before.
Yep.
Now do the other side. See if you have as much of that sensitivity there.
It's still there, but it's not as bad.
It's bad. Remember, it was also down below too,
Yeah.
wasn't it? How about down there?
It's not as bad.
Not as bad. Okay, good. Excellent. Now, the other thing I want you to do is take your ankle up and rotate it for me on that side there. That's your better side, correct? Wiggle your toes. All right. Give me the old hitchhike sign. Good, good. Now do the same on the other. Now, you couldn't move like that before, could
No.
you? Wiggle your toes. Okay, hitchhike on back. There you go. Now, once you get up, and I don't think now we need your dad, do we?
No.
Okay, so go ahead and, because before we were afraid you were going to fall. So go ahead and walk toward me, please. There you go. Walk on back, please. Atta girl. Now tell me, remember you had diffuse pain throughout the entire left lower extremity. Remember that? All the way up into your hip. Do you still have that pain?
It's not like all the way down. I mean, it's mostly like centered in my hip and in my foot. It's
Right.
not really in my knee anymore.
Right, not in your knee. Okay, and that's a weight-bearing part. Now, the other thing we asked you to do, which we were a little concerned about safety, is to walk on your toes. See if you can take 3 steps on your toes now, safely. Atta girl. There you go. Going back. Now, stop you showing off. You're not ready for ballet yet. We got some work to do on that, okay? All right, let's go on your heels now. There you go. Good. And go on back, okay? Now, remember how your pain really increased when you did that
Yeah.
before we treated you, right?
Right.
So you're able to tolerate that better?
Yeah.
And most important, do you feel safer now?
Yeah. I feel
Because you
more
need heels to
control.
go downstairs, you need toes to go upstairs, right? Mm-hmm. Feel you can be you're much safer now doing
Yeah.
that? Okay, why don't you go ahead and sit down. We'll go over a couple things here. Now, The things we want to go over with you real quick here is the treatment plan, okay?
Okay.
Now, we talked about the heated pool exercises, why that's very, very important. Because there's only so much you can do with weight bearing, okay? Especially with that left lower extremity of yours. And so you got to build up those ligaments, you got to build up the bones, and so remember, you've had this going on for 4 years. That's a long, long time. And the only way to do that effectively and quickly in terms of overall rehabilitation is through the heated pool exercises. We talked about the 4 reasons why. Reason 1, the water allows you to get the weight bearing off that leg so that you can get the range of motion that you vitally need. 2, the water itself making contact with your skin is a desensitizer, okay?
Okay.
And number 3 is you're least likely to re-injure yourself. That's something we want to really try to avoid for the next year, okay, is re-injury. And number 4, water can be a profound stress reliever. I know you know about a technique in the water called Watsu, okay, and that's something that I'd recommend you consider doing. Now, we also talked about how will you know if you need another ketamine infusion. Now, after doing over 100 of these, we now know that, you know, to get patients to where we want them to be on their own, it may take 2 or 3 of these, okay? Rarely does it take 4, okay? So what I'd like you to keep in mind is what we call exercise tolerance, measuring exercise tolerance while you're in the water. We talked about, you know, you have to come up with something that you can measure. For example, how many steps you can make with the water, let's say, up to your navel, okay? Or it could be how long you could tread water. And you measure that each week, and you look and see if you're making progress. If you're improving on your exercise tolerance, chances are you probably don't really have to be anxious about getting another ketamine infusion because you're getting better on your own. On the other hand, if you're not making progress, or if you're going in the opposite direction, you probably need another ketamine infusion. That's the best advice I can give you at this time on how to make that decision.
Okay.
We also talked about what if you go into the water and you exercise and you have no pain when you get out. Is that good or bad?
That's bad.
That's bad. Why is it bad?
Because it means you're not doing enough.
That's right. But we also talked about, you know, you want to get a good hangover, right?
Right.
And what's a good hangover?
Where you're a little bit sore the next day, but you can still go on with your daily
Exactly.
activities.
Exactly. If you overdo it, you could be laid up in bed for 3 or 4 days, right?
And that's bad.
So that's what that's all about. Okay. Now let's turn our attention over here to Dad, and you were there during the whole time, and I want you to focus in on this whole idea of from your standpoint, you were there all the time.
Right.
And do you feel it was important that you be there and not some strange person like one of my nurses or something?
Sure, it was critical. I mean, Erin had asked me several times if I'd lean back just to grab the chart to write down her vitals. She'd always say, "Where did you go? Are you coming back? Get back here to hold my hand," and those kind of things. So she wanted that reassurance that I was right there. So I think it's very critical that you talk very softly to them as they're going through the process, and I think you'll find that they'll respond, much more positive in terms of the heart rate going up and those kind of things. So it was very, very important that I was there.
Yeah, right.
I'm glad I was.
Yeah, and so that underscores it's part of the treatment, isn't it? That
Yes, sir.
the significant other someone the patient trusts knows to be there.
That's exactly right.
Now, we try to create which is not as important, but nevertheless, do you think having some music videos and things like that to play during the course of the infusion, was that helpful?
Yeah, the videos I think were fantastic. Not only for myself, I haven't watched that many videos in years, but I think the critical piece was when we put on the Celine Dion video, basically the music video. It was very comforting for her, particularly at that high dosage of 200 milligrams. She was just very, very content. She was singing along with the video.
Right.
So, but we probably should have did that earlier. Probably should have had some more music videos and kind of interchange them. Watch a video, then watch a music video, or something like that. I think that'd be even better, even more effective.
But no, Erin wanted to watch these comedy videos, and I said you were too young for it, right?
Yeah.
Because some of those
I've seen them.
Some are, well, I mean, still a little on the racy side.
Yeah,
So now we learned, right? We got to move right into the music videos a little sooner. So what do you think? Was it worth it?
Yeah, it was so worth it.
Yeah.
So worth it.
Yeah, good. And what is your mood like? You feel like a lot more hopeful now than you did before? Yeah, good. Excellent.
Ecstatic.